Cancer. General manifestations of cancer. Well, we have the systemic inflammatory and immune responses that we spoke about in other classes. They kick in for cancer. We have an increased metabolic rate that's caused by the tumors. We have paraneoplastic syndromes. They are hormonal, neurologic, hematologic, and chemical disturbances in the body that are not directly related to the tumors. Now, tumors can secrete hormones. They can change the fluid and electrolyte balance of the body. They can promote hemorrhage. They can promote infection. They can do other things. And then there's the local effects of tumor encroachment on or obstruction of neighboring tissues. The tumor getting bigger and pushing on the things around it. Okay, so with cancer we see lymphadenopathy, fever, anorexia, cachexia, a palpable mass, sometimes, not always, and the loss of tissue function. Treatment goals. We would primarily love to totally get rid of the cancer. That's the first one on your list. If we can't do that, we want to control the growth and spread of the disease. If we can't do that, our goal is to reduce the symptoms without curing the cancer. That's the palliative care. That's making people feel good, focusing on their quality of life, but realizing that we can't cure this. It's not going to be cured. Treatment available. We have surgery. Try and get rid of the tumor if we can. Chemotherapy. Now that's a systemic treatment. We put these chemicals in the person's body. It travels all over, not just the cancer cells. It travels all over the body. Radiation. That's a local treatment. We don't irradiate the whole body. We just irradiate the tumor area. We have hormones, because some tumors are hormonally dependent, so we mess with our hormone balance to try and control the cancer. And then we've got immunotherapy, which uses biologic response modifiers. Each individual person has a biologic response. Well, these agents try and change their individual responses, and they try and tell the body to increase their own self-protection mechanisms. What are the adverse effects of these? Well, surgery, not all tumors are operable, and if they are, we get bleeding and infection. You know what? We get bleeding and infection in the next two as well. We have bleeding, infection, and poor wound healing in chemotherapy and in radiation. In chemotherapy, we also get nausea, vomiting, and hair loss, and immunosuppression. So they're very vulnerable to get other communicable diseases. Radiation, we've got the bleeding, infection, poor wound healing. We also have skin and local tissue changes, and sometimes anemia. The effect of hormones, it depends on what hormone we're giving them. And adverse effects of immunotherapy, there really aren't very many at all. Cancer prevention. Well, we avoid carcinogens. We avoid tobacco. We try and not sit in the sun all day long. We use sunscreen. Health promotion activities. That's your diet, your exercise, vaccinations, that kind of thing. And protection against chronic injury. That includes sun exposure. Remember, chronic irritation can be carcinogenic. So you don't want the constant injury to the lung tissue from asbestos. Adult versus child cancer. Adult cancer is usually in the tissues and solid organs, and the ones that have an epithelial origin. And so we'll see things like colon cancer, lung cancer, breast cancer, prostate cancer, all those things. Whereas childhood cancer develops from a different layer of the body. It comes from the mesoderm. So with kids we see bone cancer, cancer of the blood and blood vessels, muscles, lymphatics, connective tissues, and kidneys. We'll see leukemias, lymphomas, sarcomas,